My name is Eyal Shaltieli. I work at the Digital Health Division at the Ministry of Health. First of all, I want to apologize on behalf of Yehuda Reuven from the National Digital Agency, who could not attend. He's one of our partners and could not attend here today due to his military service. So apologize on behalf of him. And I will jump right into a short review of what has happened in the recent years and what to look forward in the coming weeks or coming future. So in the last 5 years, the Ministry of Health, along with its partners in the government, the Israel Innovation Authority and the Israel National Digital Agency, invested 100 million shekels to promote the establishment and development of health data research infrastructure and digital health innovation centers in health organizations. We saw in this period, we saw a significant growth of such infrastructure and innovation centers. In 2017, there were 3 to 4 health organizations who were interested in data sharing and data collaboration, and today we have over 20 such organizations. We also saw a substantial improvement in the access of to health data for research. Health organizations moved to more structured, standardized format of a process to collaborate with researchers and the industry, and we see that the time to get access to the data has shortened significantly. And looking forward, we can see 2 main pathways. The first one is putting innovation into practice, assisting health organizations take these advanced digital health technologies and tools and utilize them into the clinical settings. Following October 7th, the Israeli Ministry of Health is focusing on 3 main fields: mental health, rehabilitation, and child development. And we are expecting to publish in the coming weeks several support programs in these areas. So stay tuned and look forward to that. And the second pathway is investing in data quality and interoperability. In this regard, we are currently working on the Health Data Portability Act, which will enable patients to share their data in a standardized format in the data standard. So that's also something that could move forward everything. And you'll see in the next couple of hours the fruits of this great work that has been done in the government and in the health organizations. And I encourage you to go to the health organization, contact them, and use the opportunities that come with this great work. Thank you. Enjoy the rest of the day.
But now, after we heard about this interesting plan and that we made together, it's interesting to understand what is the connection now to the Israel Innovation Authority, because we have already put the investment on this program. So a short brief about us. Okay, so our mission at the Israel Innovation Authority is to strengthen the competitiveness of the Israeli Innovation Hub, and we do it through 3 pillars. The first one is direct investment in high-risk tech-based ventures. This is the first one. The second one is promote emerging technologies by investing funds in applied research and commercialization of knowledge and more. And the third one is removing growth barriers through regulation, taxation, etc. And I'm pretty sure that you have already heard about our announcement a few weeks ago about our new plan aimed to help Israeli high-tech ecosystem that was damaged by the war and the unstable and uncertain situation here in our beloved country. And the plans include several key indicators. The first one is Revolutionary Startup Fund. You can find here all the details regarding the ideation fund and the pre-seed, seed, and the round A. The second one is the New Yozma Fund to encourage Israeli entities to invest in Israeli venture capital funds. And the third one is a new fund creation incubator fund. You can find all the details on our site and register for specific webinars to get all the details. The first one was today, and we are very anxious and invite you to apply for those funds. Okay, additionally, we have our ongoing funds for applied academic research and also for knowledge commercialization and creating knowledge from new technologies for a company through, thank you, from pre-product research. And we also have bilateral funding, investment fund with Horizon and Europe and Singapore, and Tal will tell about them later. And those funds is for R&D project. So you can engage with the healthcare organization, learn about the existing infrastructure, and create partnerships to apply for all those funds. We really urge you to do so. So because we really want to be confident that our investment were to somewhere that is worthwhile. So please do it. And this is the perfect time now to go over to our next session when we will put a spotlight on selected success stories from both startup and health organization collaboration projects. So for the first session, I want to invite Renana Ofan, CEO Sha'arei Tzedek Scientific Madait, and Shmulik Shapiro, EVP Business Development and Strategic RSIP Vision. So RSIP Vision was desperately seeking data until Sha'arei Tzedek Significant came along. Sha'arei Tzedek provided RSIP with data they needed and when they needed it. So let's welcome our first speaker to hear more about this collaboration.
Hi, everybody. I'm Shmulik Shapiro. I'm a partner and VP of Business Development at RSIP Vision. We specialize in developing AI and computer vision-based solutions for medical devices. Happy to be here.
Sha'arei Tzedek Medical Center treats over 1 million patients annually. That is a lot of data. We work with startups as well as established companies by providing intuitive access to data, running pilot and validation studies, and clinical trials. Our goal is to provide startups with the essential resources they need in order to move forward in the product development process and transform innovative healthcare ideas into impactful solutions.
At RSIP Vision, we provide the technologies that actually enable and empower the next generation of medical devices in many different fields, such as cardiology, urology, orthopedics, and surgical robotics, I'm sorry. These technologies are integrated into medical devices of some of the largest vendors in the world, such as Medtronic, J&J, Hologic, Edwards, and others, and they're actually the ones that push that into the market. Besides the algorithmic work and development, we also handle a great deal of the clinical work, including data collection, running clinical trials, and validation studies. I'm happy to say that Sha'arei Tzedek is our #1 medical center in regard to clinical collaborations.
And we are honored to be a part of the incredible work that RSIP are doing. So Shmulik, can you share a bit about one of the projects that we've worked on together?
Yeah, sure. So I think one of the most exciting project we worked on together, and you can see an image here behind me, I'll talk about it in a second, is NefSight. And NefSight is basically an intra-op AI-based augmented reality solution for surgical robotics. I'm sure that many of you know that today the robotic systems are actually brainless. Okay, they rely on the surgeon's capability, know-how, and expertise to actually perform the surgery. Our solution, the left side, actually wants to change that. And it enables precise navigation throughout the whole surgery. For example, it allows the surgeon to locate the tumor. It shows him a visualization of the surrounding organs and areas of interest. It makes sure that the margins are done correct. And also, at the end of the day, it improves the clinical outcome. To do so, we use some of the most innovative AI technologies, and that's all under the hood. So, for example, we have tool detection and tool tracking. I think a nice thing that you can see on the image behind me is the tissue tracking. You can see that actually the augmentation is staying on top of the tissue, although the kidney is moving all the time. This is, of course, real data from a real partial nephrectomy surgery. I'll let you think alone what hospital it was taken from. And of course, the patient is breathing. So this technology is very crucial for this solution. And also we have real-time fusion of different modalities during the surgery as well. In this case, it's ultrasound, video, and pre-op-CT.
NephSight is truly amazing. So Shmulik, RSIP Vision is a successful company producing cutting-edge technology. Can we take a step back and share why you turned to Shaare Zedek when you could have chosen to work with any hospital in Israel?
Sure. So besides the obvious, working with Urine, and of course, a few more reasons. So I think the first one is the amount and variety of data, right? Because at the end of the day, we need a lot of data, and we need a variety of data, okay? Different fields, different use cases, different imaging systems. Some of the systems that we need are the most cutting-edge technologies, and I'm happy to say that Shaare Zedek has all of them, and that's even the reason we came to Shaare Zedek regarding this specific project, and thank you for that. The second is, I would say, time to respond, and what I call time to data, okay? How much time would it take actually to get the data into our R&D team so we can start working on that? After all the needed queries, validation, protocols, IRBs, signatures, and everything. And that's crucial, okay? Because time is always of essence, and that's the same with us and our clients, and this is a big thing as well. And the third, like always, team, right? So we always talk about team regarding our own company, but it's the same when choosing a collaboration. You need to have a strong team. You need to have a team that will take the extra mile with you, make the extra effort, and overcome all the challenges. And I'm happy to say that we truly found all that in Shaare Zedek, and that's the reason both we chose you, and also we're continuing this great collaboration.
Thank you so much. On to another topic. Shaare Zedek won an Israel Innovation Authority Award, which helped us further develop our infrastructure, enabling us to work better and more efficiently with industry. So Shmulik, I'd like to ask you, considering that RSIP and Shaare Zedek has been working together for quite a few years now, what changes have you noticed since we won the Israel Innovation Authority Award?
Great question, thank you. So yeah, I can personally say that I've seen that the whole process became more seamless and more comprehensive after all the changes that you implemented due to this grant that you received from the Israeli Innovation Authority. I believe that today the infrastructure that you have, including the whole process, is extremely suitable to support collaborations with AI-based medical device companies like ourselves. And it includes and covers everything from IT through data analysis, moving into clinical support, clinical consultancy, and even participating in the procedures themselves, because when we're talking about developing intra-op solutions and medical devices, it's extremely important. Second thing, response time, turnaround time, a lot quicker today. When I shoot a question for even one of your teams in email or in WhatsApp, I'll get the answer in the next day, and that's awesome. That's exactly the kind of response time that our customers are expecting from us, and it allows us to move forward very quickly with projects and actually secure a lot more business at the end of the day. And maybe the last thing I'll say, that the whole process is streamlined. from signing the data license agreements, moving to data verification, anonymization of the data. Everything is so easy to handle. And I mean, I need actually nothing more than that.
Thank you.
You have 1 minute.
Oh, 1 minute. Quickly. Finally, can you talk really quickly about some future challenges you anticipate?
So yeah, I say it quick. I believe that the future is in intra-op solutions, just because so much has been done already in screening and diagnostic solutions. All of us know companies around that, and it's already changing the face of healthcare all around us. But actually assisting the clinical teams in the surgery, in the most invasive environment, that's the real next challenge.
Thank you so much, Shmulik. And full disclosure, we're not paying Shmulik to say all these nice things. He's actually the one paying us. I would like to thank the Israel Innovation Authority for their support and recognition in this award, enabling for us to work better with industry, and for the opportunity to present here in this conference today. And for you in the audience, startups, if you are looking for a hospital to collaborate with, if you are looking for quick and easy access to data, patient samples, validation studies, beta site, clinical trials, or just advice, please come visit us at our booth, Shaare Zedek Scientific, Mada'it, and Sha'al, together with Arieli Capital. We'd love to hear your needs and see how we can help. Thank you, everyone. Thank you, Shmulik.
Thank you very much.
In the upcoming minutes, we will hear how Patolab Asuta's leading pathological laboratory, in partnership with IBEX Medical Analytics, are using AI and machine learning for routine cancer diagnostics. You will learn about the vast array of data Patolab holds, from statistical datasets to extensive DNA repositories, and how it is used to develop clinical grade algorithms and AI solutions that transform healthcare.
So I will dive into the pathology laboratory in 60 seconds. This is the sample journey. My name is Noah Bishitz, and I'm from Patolab, the pathological laboratory of Asuta and Leumit. So we get the samples. Each specimen is taken out of the patient body and go inside a formalin tube. Do we have a pointer, maybe? This one? Never mind. We get the sample inside a formalin tube, and then we do some registration, and then we take it out of the tube and do a macroscopic evaluation. You can see it on the top picture. It is actually a womb, and we see and describe it, and then we take some parts of the womb or the specimen and put it inside a cassette. The cassette goes through the middle picture and goes some dehydration. We take out the formalin and we put inside paraffin and we reserve the sample. For the future, we can make DNA from each sample. You can see the amount of DNA samples that we have in our lab, and we can think about it together. What can we do with the samples? So then we take it to the lab and make some slides on this picture, and then we scan it. This is why I am here. Usually the pathological old way was to see the slide under a microscope, but due to the collaboration with Leumit and the Innovation Authority, we can scan the slide with this scanner, and then we can just see the slide like you see in the up picture. So we scan all the slides, and then our pathologist can see the slides and the medical file of the patient, and then give the pathology diagnosis right at the computer. As you can see in the up picture, this is where IBEX and Tal get inside the picture, and we use AI solution inside our pathology diagnosis. Tal?
Thank you. Hi, everybody. My name is Tal. I'm from IBEX. I'll try to be brief. You had a 60-second course on pathology, and why is it important? I'll add the AI component to that. I'll try to be even quicker. In a nutshell, about our company, an Israeli-based startup with offices around the world. We've raised over $100 million to date. And what we do is basically transform cancer diagnosis using AI. What you see here are pathologists. These are not models posing for doctors. These are real doctors who analyze and diagnose cancer using digital pathology and AI. What you see here is a heat map. Many of you know that. That's a representation of location of certain pathologies, in this case, prostate cancer, over a biopsy. And what you see here, which is taken from one of our customers in the United States, is exactly what goes on at Patholab and in many other labs. What AI is enabling to pathologists and cancer diagnoses when they are using our system is that we like to refer to it as a digital assistant, a never tiring digital assistant that helps the pathologist reach the correct diagnosis. We are not here to replace doctors. We are here to augment their capabilities. Our technology is analyzing an AI algorithm, which we develop with the help of organizations like Patholab, which help us with their data sets. Our AI algorithms are analyzing the biopsies, the image of the biopsies, before the pathologist review. So when the pathologist gets to work in the morning, they already get a work list of all the cases. They already get first look into the results of this diagnosis, and they can decide which cases to start looking early. So if previously under the old regime with microscopes, you had to go case by case, you never knew what was coming. It could be a benign case, it could be a very difficult cancer case. Nowadays, you can decide to take, for example, cancer cases up in the morning when you're still fresh and remove them and have them immediately reported so that the patient can get treated. That's just one example. The other advantage that we provide is accuracy. The image that you saw previously, the pathologists in the US have done an analysis in their lab, and they know that their error rate is between 1% to 2%. That means that 1% to 2% of cancers are being missed. And this is a terrible outcome if you're within these 1% or 2% of the patients. And post implementation of our technology, their error rates went to almost zero. So again, AI enables us to, a combination of AI and pathologist enables almost zero error rate. And there is an additional efficiency gain in terms of the time it takes the pathologist to review a case. And that again translates into efficiency at the lab level, less of gray area cases, reduction in numbers of additional tests, so economical benefits for the healthcare at large, etc. This is a footprint of of some of our customers. As you can see, we are spread well over the world. These are all live AI sites at hospitals, health systems, and large laboratories around the world, which are using our technology to diagnose breast, prostate, and gastric cancers every day. And to sum up the collaboration, which has started quite recently with Patholab, and we look forward to continue this work in the future. The recent system, the recent algorithm that we have launched, which is called Galen Gastric, which is targeting diagnosis of gastric biopsies. We set out to validate the work of pathologists who use this technology and compared it to the work or the accuracy levels of pathologists who do not use AI. And this study, which was conducted in the UK, France, and Israel, with the help of pathologists from Patholab as well, was presented in the latest European Congress of Pathology a few months ago. And the results surprised even us at IBEX. It turns out that the pathologist, and I'm using this word carefully because there are doctors here, but we were able to demonstrate superiority for the arm of a pathologist and AI over pathologist alone, which means that pathologists who used our AI technology were 25% more accurate in diagnosing gastric cancer than pathologists who did not use AI and diagnose manually. diagnose the biopsies manually. I don't know how many of you know that, but gastric cancer is considered one of the most lethal ones. It's prone for late detection. Missing missing a gastric cancer is a very, very bad, means a very bad prognosis for the patient. And if we are able to increase the accuracy levels by 25%, this is a huge benefit for AI. So again, we look forward for these benefits to realize at Patholab, which is now using our system, and in our other customers around the world. Thank you.
So another sentence, we have over 1 million slides that are already scanned in our data, and we invite you all to come and see this data and dream big, invent something new.
In the next 3 minutes, I'll tell you about Soroka Research Innovation Institution and the services we offer to the industry. So, in our institution, we have more than 90 employees, including, שומעים עכשיו יותר טוב? Okay, epidemiology, data analyst, physician, research coordinator, etc. We approve service to dozens of companies, both startups and pharma. We lead and support hundreds of projects per year for the hospital, academy, and special attention to the industry. We have access to the data of Soroka, and recently we have also data for access to the data of all the national data of Clalit. And we also have a large biobank, more than 40,000 samples. And all this is located in Soroka, which is the largest hospital within Clalit and the second largest in Israel. So about our services. First of all, we have now, it's new, feasibility test platform. It's a new platform that you can submit query like how many patients under age of 60 were diagnosed with stroke during the year 2005 to 2023. And our analyst will return a numerical answer by 3 days. It's free and supported by Innovation Authority. So thank you again. And so I think this is a great starting point. And then after you find that you have something, you have your population, we also manage before you can scan the QR code, okay, and use it and submit your query just now. And also we provide research management from investigation initiating studies from beginning to finish, from planning the research, writing the protocol, etc., until the summary results. And we also manage research that based on data, which is called data research. And Soroka use also as a site for a clinical trial. And of course, our Negev Biobank, which is actually the service we provide to NREL. So, few words about our Negev Biobank, which is a member of Midgam. The biobank contains sample of blood, urine, stools, cancer, tumors, and actually everything you can think about we can collect. We have two main operational activity. One is sample collection from the general population. We collect it in the emergency room and the maternity ward. And the second is build a specific collection of a specific disease such as Parkinson's, stroke, Koltzvod-Yakov, we have a big collection, kind of malignancy, etc. And we also can do a prospective collection. We handle in the regulatory aspect, collection, processing the sample, and persuasion. And I invite you to learn more about our services, visit our site, get in touch, and of course submit your request in our new platform. For information on clinical service grant, up to 50,000 shekel, please visit Synergy 7 booth. And before I pass the mic to Alina, I'll share how amazing it to get up morning, knowing that we are helping company like Venial to do such innovation and exciting thing. Thank you.
So Renewal Bio is a young startup company that was established in 2023. Our main interest is the development of cell replacement therapy for applications in regenerative medicine. Our technology is based on the findings of Professor Jakub Hanna from the Weizmann Institute, who is a leading expert in reprogramming pluripotency and synthetic embryo models. So Renewal develops a unique stem cell-based differentiation platform that is capable of generating patient-specific, authentic cells that are suitable for autologous transplantation. This is based on development of embryo-like organoid models that we call stemboids. So let me take you to the journey of a potential patient that, for example, needs a bone marrow transplantation but doesn't have an available matched donor. So we can take we can take skin biopsy from such a patient and extract somatic cells.
You have 1 minute. 1 minute left.
Okay. Then we can reprogram these cells using Yamanaka factors to induce pluripotent stem cells. We will grow induced pluripotent stem cells in a special media, naive media, that endows them with unique, with extended differentiation potential. And then we can differentiate them to extra embryonic lineages. Together, these 3 lines, we can aggregate them to form our stemboids. Then we will continue growing them in the process of maturation and our special ex utero culture device until they reach the desired stage in which the desired cells arise. In our case, it will be hematopoietic stem cells. Then we can isolate them and extract them and transplant them back to the patient. So we found that using of addition of human serum to our culture media significantly contributes to elevation of stemboid yield. So to find what elements in human serum contribute to this effect, we're collaborating with Soroka Medical Center to obtain various serum samples from peripheral blood and umbilical cord blood. So we will evaluate these samples by adding them to our culture media and submit them for metabolic profiling in order to isolate the factors that contribute to elevation of our stemboid yield. And eventually we will decipher these factors, and this will allow us to transition to use serum-free media. So we're very excited about such a collaboration and hope that it will pave the way to our next breakthrough in our research. Thank you.
Well, and now for our first representatives, a trio. not a couple. I want to invite Dr. Nofar Moore, head of the RNA therapy program, SCRC, Sheba Medical Center, and Ariel Feiglin, CSO, Skip Therapeutics, yes, and Sharon Paz, Business Development and Agreement, SCRC, Sheba Medical Center. In the next few minutes, you will hear how Sheba's genomic data has become Skip's secret sauce, powdering their innovative solution with a healthy dose of DNA wizardry. It's a classic case of a doctor meets entrepreneur, a match made in the double helix, driving medical breakthroughs with the wings and strand of genetic flair.
My name is Sharon Paz, and I'm the business director of the Cancer Resource Center at Sheba Hospital. I'm very glad to be here. Today, we are going to describe to you a short case study of how we at the Cancer Center work with different startups. Nofar will start by describing our different databases that we are having and which were developed by the generous grant that we have received from the Innovation Authority of Israel. Thank you so much for that.
Hi, I'm Nofar. I'm the head of the RNA therapy unit under the Sheba Cancer Research Center. Okay, so I'm Nofar. I'm the head of the RNA therapy program at the Sheba Cancer Research Center. And today I'm going to present what we do in the center in order to provide services and databases for other members of the scientific community. So the center has been for many years now a hub for innovation and excellence in terms of in the field of precision medicine. It is headed by Professor Gidi Rechavi and Dr. Dan Dominicini. Both have a very vast experience in research, both basic and clinical, a lot of knowledge in genetics. And in the last years, we have developed tools and techniques and approaches in order to pursue our research in precision medicine. And during that process, we acquired a lot of data. We acquired data in proteomics and genetic data. And now, thanks to the kind help from the Innovation Authority, we can allow other people to see it as well and to use it, and to allow biotech companies to use it for their own needs to pursue their research. So apart from our databases, we also offer services in terms of sequencing services and proteomics, but I won't go over it. You can check it in our online catalog, which is available in this QR code, and you can just come and talk to us later. I will focus on the fact that we offer services in terms of helping you interpret clinical variations, genetic clinical variations based on our experience and based on AI-assisted algorithms. And we offer, as I mentioned, a lot of databases containing genetic and clinical data from patients, thousands of patients which arrive to our unit for exome sequencing, genome sequencing, proteomic analysis, and so on. The data is obviously anonymized, but it can be traced back in order to reveal both phenotypic clinical data, genetic diagnosis, and everything else needed. It's very important to note that we don't just dump the data on you and go away. We're here to help you and assist and accompany you in the project, both in order to help you maintain and plan your experiment in a way in which we can assist, but also if you'd like to consult later regarding your analysis, regarding follow-up experiments or anything else. And this is actually the foundation to our collaboration with Skip, which Ariel now presents.
Okay, so thank you, Sharon and Nofar. So I'm Ariel Feiglin, co-founder and CSO of Skip Therapeutics. And at Skip, we focus on computationally guided development of RNA-based therapies for rare genetic disorders and a bit beyond that as well. So just from a bird's eye view, just a word about RNA-based therapies. So RNA-based therapies are really good tools to develop new therapies for rare genetic disorders. And the real challenge of RNA therapeutics is, as opposed to conventional therapies where actually creating the molecule is the challenge, using RNA therapies, The challenge is actually identifying a therapeutic or a molecular strategy that is relevant for a given mutation. So most rare disease patients aren't even assessed for therapy. And in that regard, we've developed a computational bioinformatic engine that can take any patient mutation, analyze it, and determine a course of action, a molecular course of action that is relevant for an RNA therapeutic, and then it can also guide the design of the therapeutic itself. And this is exactly what we've done with Sheba. So in rare disease, it's very important to not only analyze data, patient data from public databases, but also to engage actually with the clinical setting. And Sheba were kind enough to give us access to 1,500 rare disease patients. And we used our computational engine to analyze these patients. And we identified about 260 patients that have some kind of therapeutic solution based on RNA. And then we kind of do iterations with the Sheba experts, and we get feedback, and then we can re-rank our solutions with the goal of identifying a handful of patients that will be selected for a personalized drug development program. So that's what we've done so far.
1 minute.
I just want to make clear of a couple of points that we at Sheba, the Cancer Center, very look to oblige to. We are not taking any IP shares from the startups that are coming to work with us. We have a full flexibility with concerning the legal models. We can work with, like, if you want, joint IP, but it's up to the startup to decide. Or we can do service agreement, collaboration agreement, whatever model that the startups wish to work with. Also, as Ariel emphasized, it's not a one-time meeting. We keep following with the startups, working together, ends by ends. Like here you have the diagram of the process, working with Skip, but it wasn't one-time meeting. He met Professor Rechavi and Dr. Nofar here a couple of times to make sure that he gets the right information and genetic sequencing and whatever he needs. Also, another additional point that I would like to point out is that our solution is tailor-made for the needs of the startups. We can always work and to try to give you the best solution to the need that you have, your needs. And we are doing it really quickly and fast. Usually the duration is 4 to 5 months up until the contract is signed. And we are trying very hard to stick to that. We have the catalog, the catalog that Nofar mentioned, just there at the desk, and we will love that you will come to sit with us at the afterward. That's the B2B during the B2B, and to try to see how can we work together, or if we can work together. Thank you so much, Yael, Eyal, and Yehuda. Both Yaels.
And I'm Izar Laufer. I'm the managing director of Leumit Start, which is Leumit Health Services Innovation Unit. And first I would like to, where is the clicker? I would like to introduce you to Leumit Start and what the kind of services that we supply to the industry or startup mainly. So the first service that we supply is business and regulatory consultancy. It's mainly addressed for early entrepreneurs in the beginning of the way. The second service that we have is a clinical consultancy from our physicians in Leumit HMO. The third service is design partnership. When the company wants us to be active in designing and taking part of development of the product, and we are very welcoming to this option. And the two major services that we supply today to the industry are access to clinical data, which I will just explain more, and of course, conducting clinical trials in our 330 branches nationwide. In general, we are operating since 2018, and we operate in three main areas. The first is digital health, the second is medical devices, and the third is diagnostics. And I mean diagnostics that done in the laboratory, and also diagnostics that is done in the patient home. And we are here because of the data infrastructure. So first, we would like to thank the Israel Innovation Authority for helping us to supply this kind of infrastructure. As for today, we have more than 21 years of EMR data, and in addition to this, 21 years of EMR data ready for research is 9 million visits per year of physician notes, and 1.5 million notes per year for nursing. We also have all the free text de-identified and ready for research. We have raw data of ECGs, of cardio holters, X-ray, US, ultrasound, ready for research. We have an infrastructure of virtual lab rooms when we give the companies the option to install their preferred research tools and conduct the study in the cloud on the identified data that they get from us. We have a collaborative data lake with Sheba Hospital. It's a merged data lake with all the data from Leumit HMO and the data that we have in Sheba for this specific patient. And as was mentioned here before by Patholab, we have a collaboration with Asuta and Patholab regarding digital pathology. And on top of that, when startups want actually to work in production after the research stage, we have a set of APIs ready for operations. So the integration, I'm not saying it's a walk in the park, but it's much easier to do integration with all the APIs are also already here for collaboration. In this particular collaboration, we have the privilege to work with Feel Better, which is an amazing company. And this specific collaboration, we gave them access to hundreds of millions of data points. You can see here various areas of data that we gave access to for research of Feel Better. And I'm heading now to Yoram, who will explain about their product and how they use this data.
You have 3 minutes.
So Feel Better is focused on polypharmacy patient management. What we do is we leverage AI. We leverage AI in order to analyze large cohorts of patients and identify which patients are at risk for the deterioration due to their suboptimal medication regimens. And we not only identify those patients and allocate the resources accordingly so that they can get the right attention, but also identify what needs to be done in order to ensure that those patients stay safe in the community. So how do we do this? There are two data sources that are critical in this analysis. The first is the full modeling of all of the pharmacological, clinical, and treatment data. And all of this is done within a system that enables us to actually look at the patient's health journey, analyze all of the different data points, and understand how those data points build the full story of the specific patient's health journey. The other part is what the collaboration with Leumit was focused on, and this is the full longitudinal view of a patient over the full treatment phases. So in this case, we had 20 years of data, EMR and claims data, that enabled us to analyze that data together with the first part and have a comprehensive understanding, evidence-based, of what are the different cause and effects that went through the patient's health journey, and based on that analysis, understand which patients are the ones that should be focused on and what specific actions are the most relevant and the highest priority ones. This is, of course, all fed, the big data is fed into our algorithms, and this enables us to then pinpoint specific patients with specific defined actions that are then used as part of decision support for the clinicians.
1 minute.
So going back to how we started with Leumit, we started with a retrospective pilot that was supported by the Israeli Innovation Authority. Based on this retrospective pilot and the amazing results we received, we decided on a full implementation within Leumit. We rolled out our system into all of the consulting pharmacists in Leumit, and now we are looking at expanding it to additional clinicians in Leumit. And here you can see a few examples of the results of the implementation. You can see a very high adoption rate. Actually, all of the consulting pharmacists are using our system for all of the consulting. From the other side, you can see a very nice increase in the capacity of the bandwidth of each one of the pharmacists when they engage in patients. And of course, on the outcome side, you can see that there's a significant reduction in preventable hospitalizations, as well as improvement in the chronic disease management and a reduction of the different chronic diseases that are uncontrolled for the specific cohort that was attended to.
Thank you very much. I invite you to visit our website, innovation.leumit.co.il. And we have a table here, so anyone who already scheduled a meeting with us is welcome to meet us there. Thank you very much.
I'm Tal Ben Avner from the Innovation Authority. I'm managing CERD, which is basically Singapore-Israel fund. So today I'm going to unlock for you 2 funding opportunities from the Innovation Authority, basically focusing on opportunities for funds for international collaborations. I will start with the very bottom line. We have a stand over there, and we're very keen to speak to you and to present you the opportunity that we have. So, few words about CERD. Singapore-Israel Innovation R&D Foundation, and simply CERD, has been around since 2000. Sorry, been around since more than 2 decades, 2.5 decades even, and approved over 196 projects with an total approved grant of over $100 million. And as you can see, it's a cooperation between the Innovation Authority and Enterprise Singapore and Singapore. So basically what we do, what we are doing is fast. We provide a partner search tools. If you are keen to do kind of R&D or a pilot project in innovation projects and technologies, so we are providing you the assistance and the tools to locate a partner in Singapore and both in Israel. We have counterparts in Singapore helping for us in this purpose. So this is the first part. Second thing, and maybe more important, is that we are providing financial support that can reach up to $3 million in support. Behind CERD's most beneficial thing is that we do not take equity. We're not sharing any IP rights on the projects that have been developed in the process itself. And of course, we are shortening time to market. We are sharing risk with the companies. And basically, we are here for you to promote the technological product together. So I'm here in MIXI, specifically here today to speak with you about our strategic sector track, which is focusing today in this specific round on health tech. As you can see in the left side, we have health tech as a general topic sector open for submission in this round, with the focus points of medical devices, digital health, and bioconvergence. But it's not limited to that, but it's open to all kinds of sectors inside the health tech field. Few words about the program itself. So, as you can see, we are funding up to $3 million, or 66% of the project cost, the law between them. We are aiming to see you starting the project in the TRL 3 to 4 and finishing it around 7 to 8. So it's a pretty much a long journey together with us. We are able to see that the project duration is up to 36 months, and the sector is chosen top-down. So as you can see in this round, is specifically the health tech field. So lucky for you, you are fitable. So the consortium structure is pretty unique for us. It's a 2+2 combination. So basically, we want to see a researcher, an Israeli researcher, and an Israeli company, both on the same side. And in the Singaporean side, the same thing. So it's 2+2 mini consortium that we're establishing specifically for this project. Here you can see my contact details and my counterpart in Singapore. So you can take a scan real quick if you're interested. If not, we are in the back ready to talk to you. So that's about CERD. Just one quick note in the end that our first submission is dated for 4th April in 12 p.m. So that's an executive summary, just initial submission. Afterwards, we're going to do the full submission, which will be open for submission until 1st July. So it will be 2 stages. The first stage is the executive summary. Afterwards, we're going to shortlisting, and the companies moving to the second round will need to submit the application up to 4th in July. Rather than this call, we have also a call for regular, I will say, R&D and pilot projects. It will be open for submission until same date, 4th April, with the lower grants between $1.5 million to $1 million, and you're more than willing to submit for this project as well. Okay, so the second framework I'm going to present to you is the Horizon Europe. Basically, this is the biggest funding grant system in the world, over $100 billion for 7 years program for innovation and R&D. It's covering all scientific and technological disciplines, as you can see. Israel is a participant as an association country, which means that all Israeli stakeholders can take part and submit for this program. And it can be a health organization like we have here, can be companies, researchers, academic researchers, and a lot of stakeholders. Basically, almost everyone can apply for this program. So what is it in for you? Horizon Europe is covering between 7 to 100% of the proposal of the project, the proposed project, plus 25% overhead, without any equity, without taking any royalties back. So while doing so, just thinking of maybe applying for Horizon Europe, you need to take under consideration 2 things. You probably will face 2 challenges. The first one is to find the right call for proposal in the sea of the ocean of dozens of different applications, different call for proposals. So we have CERD team that actually is here. We have a representative here that will be more than happy to help you to find the right call for proposal for you. Moreover, the second challenge you might face is that you need the right partner. Usually what you are looking to see is that groups of partners will submit the application together. And then CERD team is also here, very keen to help you to find the right partner, to locate them, and to escort you and accompany you throughout all the process until you submit the application. So the last thing I want to state is that track 37, moreover, in addition to the support that eCert provides, we have track 37, which actually allows you to receive refunds for the consulting services for this specific program. So you can get a refund for the all consulting services included in this specific program. So we have CERD, just a second. We have CERD and we have eCERD, which sounds pretty much the same. One's focusing on Singapore-Israel partnership, and the second one is focusing on European partnership. So we are sitting here in the back, and we'll be more than happy to hear you all. Thank you so much.
Well, I really want to thank all of you, and specifically for the representative that share with us those amazing stories and case studies. And I want to invite you for our last session. So if you are developing a product, in a medtech field, or need the clinical data or genomic data, or cooperation for clinical research, access to expert and infrastructure of healthcare organization, come and engage with the healthcare organization that we are and learn from them about the existing infrastructure and create partnership. Today with us, you can meet here 15 representatives from the leading organization. We have here the Research and Development Authority, Sheba, Shaarei Tzedek Medical Center. Where are you? Raise your hand. Shaarei Tzedek? Over there. And Clalit Innovation. Clalit over there. And Tel Aviv Soroski Medical Center. Ichilov? Not here? Okay. And Asuta Center, Asuta Hospital. Asuta? Asuta, תרים יד. כללית סורוקה Medical Center. לאומית. Healthcare Services. אסותא אשדוד. אסותא אשדוד, not here. Rambam Healthcare Campus. Rambam. Okay. מעייני הישועה. Over there. And the Center Research, the Cancer Research Center, Sheba. Over there. Asuto Potolav Medical Center. Over here. Governance Hospital Division. Not here. ARC Innovation and Chiba. Here. Beit Balev. Over there. Hadassit. Over there. So if you have any question, please look for my colleague Yael Gershenfeld over here, and Shomrat over there, and Judy over there. They are brilliant, and they really can help you with any answers or cooperation. I really need to hop over to my next conference. So I'm wishing you everyone a peaceful day, healthful Zeinrud, and for the soldier to be safe, and a quick return for the hostages. Have a nice day.